on it like that. Here. Thanks, Rachel. Good girl.
I am a pediatric dentist and a long-term healthcare researcher and advocate for improving access to oral health care. I am thrilled that Gainesville For All has decided to recommend dental therapy as one of its final health recommendations. The timing could not be better, as we currently have legislation in the Florida House and Senate to bring dental therapy to the state of Florida. Let me give you two examples of the magnitude of the oral health access crisis in our state. 63 of 67 counties in Florida are designated by the federal government as dental health professional shortage areas. They contain over 5 million people that cannot get access to dental care. In addition, last year, 60% of children enrolled in Medicaid in our state did not have any dental care. That is 1.4 million children that did not see a dentist, one of the worst numbers in the country. What are the results of lack of access to oral health care? And I'll give you a couple of examples. The first is now there are several scientific studies showing the relationship between poor oral health and poor school performance. The way out of poverty for many children is education, but you can't learn if you have toothaches. In addition, for adults, there's now studies showing a very clear relationship between poor oral health and the management of diabetes and cardiovascular disease. This last example is really tragic that I will give you. Last year, 168,000 visits were made to hospital emergency departments for preventable dental conditions. More importantly, there were over 4,000 admissions to hospital because the dental infection was life-threatening. In summary, last year, hospitals in Florida charged out $500 million for preventable dental conditions. Most of these conditions, if they had been treated earlier, could have been prevented and more cost effectively. What are dental therapists? Dental therapists are members of the oral health care team led by dentists. They are trained, they are very analogous to physician's assistants. They are trained for a much smaller number of procedures that a dentist would do, but their training is vigorous and of very high quality. They became experts in these smaller numbers of treatments that they can provide. Dental health therapists have practiced in over 50 countries for over 100 years, and the scientific evidence about their safety, quality, and effectiveness is very clear. In the United States, dental therapy has been working in Alaska and Minnesota for about the last decade, and all the scientific evaluations of their quality, safety, and effectiveness show that they are very good at what they do. Maine and Vermont has now passed dental therapy legislation, and about 10 other states, including Florida, are working on legislation to bring dental therapy to the states. How do dental therapists make dental care more cost-effective and reachable for many people? They work under the general supervision of a dentist, which means the dentist doesn't have to be there in the office, or the dental therapist can go to remote sites like school settings and deliver dental care. I would like to conclude with two thoughts. First, if anyone tells you that they oppose dental therapy because they think or feel that they cannot provide safe, quality care, ask them if they have any scientific evidence to back up that fear. I can tell you the answer. There is none. All the research shows that dental therapists provide safe, quality, effective health care. Second, Florida has tried to always be an innovator in the delivery of health care, and implementing dental therapy is another way to put Florida on the map as an innovative state providing for the health care of its citizens. I would therefore urge you to support Florida Senate Bill 1498 and Florida House Bill 683 to bring dental therapy to the state of Florida. I know they will improve access to health care in our state.